welcome to Take Home Pediatrics, Episode 6 on potty training. I'm Dr. Bhumi, and remember, this is just an informational video, so if you have any concerns about your child, please call your pediatrician. So let's talk a little bit about the evolution of potty training. So before the 1920s, it was parent-oriented, so it was rigid and it was structured, and then in the 1940s, the child-directed method was introduced. The potty training age since the 1940s has started to increase. So in the 1940s, about a majority of our 18-month-old children were potty trained and daytime potty trained. Now the statistics are 25% of our 2-year-olds are daytime potty trained, but then by 3 years old, 98% are. So the parent-oriented one, even though it has come out of favor, I just wanted to touch upon it. In that one, you increase your child's fluid intake in those few days that you want to potty train them, and then you have scheduled toilet times, and then you have positive reinforcement when they are correctly eliminating. So all that sounds great, and it was very, very successful. However, it was the fourth component that created some kind of controversy. The fourth component is over-correcting accidents. So that means you were verbally reprimanding your child or you were having timeouts, and that could lead to an increased risk of mental and physical abuse by the caretaker, but it also created a lot of unwanted behavior in our children. So currently, the American Academy of Pediatrics is in support of the child-directed method. So what is that? That's really just looking for the readiness cues in your children before we actually start training them. So what are those readiness cues? Your child is able to walk. Your child is able to sit and stand freely. They're able to pull off and on their clothes. They're imitating your actions. Their verbal abilities are so that they can follow some commands you're giving, and they somehow communicate with you that they need to go to the potty or have a word for the potty. So what can you do at home to see if they are showing interest or that they are ready? You can actually play games on, hey, let's imitate my actions. Let's walk, let's sit, let's stand, let's point to body parts. This way you're going to know that they're able to understand these things. The second is also to watch for your child's attention span. So think about it this way. If you have a child who's going to follow you into the bathroom, but they're going to sit for 1 second and then just run out, we're not going to really get any headway on that potty training. So we're not ready for that. Also look at how your child responds to transitions, whether they're still in the period of tantrums. Because again, if you're asking your child to, hey, come to the bathroom, and they just throw themselves on the floor and have a tantrum, then we're not ready. So again, these are good ways to look for cues at home. Another thing that is very good for the parents is so that they know what the developmental milestones are. For example, at 15 months, a majority of our children can actually sense dirty diapers. So what we're looking at is before 15 months, if we try to potty train, it's not going to be too successful. And then also by 18 to about 22 months, not only are they having the sensation of dirty diapers, but they're able to communicate with you somehow that their diaper is dirty. And then by 2 years old, they're actually having the sensation of having to go. And by 3, they're able to communicate that sensation of having to go. So that 18-month to 3-year-old is where we're looking at the most popular time for potty training. So what do I like to do? I like to actually talk about potty training at the 18-month well visit with my patients. I like to call it potty exposing in the sense that while we're showing them the potty and exposing them to it, we get to look to see if their readiness cues are there. And once they're showing those readiness cues, within the next 2 to 3 months is a good time to start doing the potty training. If we do it too early, it's going to take too long to potty train, and it's also going to cause a lot of frustrations. The other thing is, I ask you not to start potty training or potty exposing if there's going to be some life changes. You know, the most popular ones are like, hey, we're having a new baby, or we're just starting our child in daycare, or moving them to a new daycare, or we're actually moving. So those kind of things, you want to just go ahead and wait a couple of months. Too many changes in that child's life is going to cause a lot of disruption. So once we're ready, I'd like you to go ahead and practice flushing the toilet with your child, washing their hands, taking off and on their clothes so that they're ready for the actual training. The other thing is go ahead and buy a potty chair. And when you do buy it, have your child involved in picking out the potty chair. Go ahead and let them decorate it and actually even put their name on it so that they have ownership of this. You will see that then that will create a lot more independence and cooperation. So where you put the potty, initially, go ahead and put it where you think the child is going to sit on and experiment with it easily. However, once you start doing the schedule of exposing and training, I'd rather you have it in the bathroom so they have that association with the bathroom. So how do you start the exposing? I usually tell our parents first thing in the morning, go to the bathroom and say, hey, come on, I'm going to the bathroom, come with me. Or if an older sibling is going, say, hey, let's join them. So have them imitate. And about every 2 hours, before nap time, at bath time, or before bedtime are some key times to go ahead and do that. Initially, let them keep their diaper on and their clothes on if they want to. Just have them sit on the potty for the few minutes that you're in there. After a couple of weeks, if they're very cooperative, go and say, hey, let's take your diaper off and see if they're willing to do that. So you move to the next step when they're willing to. A couple of weeks of them taking their diaper off and showing a good amount of interest, you can actually say, hey, do you want to try to go pee-pee, and see if they have that sensation. As they move from step to step, you will start seeing, and some kids will take weeks and some kids will take months, but you are going to start noticing that the diapers are dry in between. And once you start noticing that the diapers are dry, go ahead and move them over to training pants or underwear, because you are on your way to a daytime trained child. And that's all exciting. When you are daytime training, please do not worry about the nighttime training. That will come. And a couple of pointers is do not flush the toilet while your child is sitting on it. You might scare them. Also for our boys, go ahead and train them sitting down until they are stool trained. You do not want to be cleaning up that stool off the floor. Also, do not make this exposing time or training time a battle. This is optimal time for our children to want independence, and they're having a lot of power struggles with us parents. And so remember, take it calmly and don't let them create that struggle. We do want you, when they are successful peeing or pooping in the potty, to verbally praise them, but don't get too over emotional, because again, remember, this is a power struggle and they're going to start understanding that you have so much stake in this, and then they will start having those struggles with you. But when you do verbally praise, just say, hey, I'm so proud of you, because you do want those positive reinforcements. But don't use a reward system like candies or snacks either, because they're going to expect that moving forward. But not only that, they're going to expect rewards other times outside of potty training when you want them to do something. So we don't want to create that habit. Also, if your child is going to daycare, or if the grandparents are taking care of them, or another family member, or a nanny, then make sure all the adults are on the same page, that we're using the same word for the potty, and that we're all having the same types of responses to the child, because remember, consistency is where we're going to be successful. So as we're daytime potty training, we are going to run into some problems. And the number one that I get in our office is my child is not trained at night. They're still having accidents at night. Please do not worry. 15% of our 5-year-olds are still wetting through the night, and that is absolutely normal. And as years go by, a more and more percentage self-resolve. So usually we don't have to do too much intervention. However, if the child is 5 years old and it is becoming disruptive to the family, or the child seems like, they're distraught by it, there are a few things that we can do that are simple. One is have them go to the bathroom 7 times in the day, and especially right before bedtime. The other thing is to limit their fluid intake in the evening without compromising their hydration. So how do we do that? I usually tell our parents, fill up a 16-ounce water bottle with water first thing in the morning, and have your child finish it by noontime or lunchtime, and then refill that bottle and have them finish that second bottle by 4 or 5 p.m. This will ensure that they get that 30-some ounces of water for the day, and so that in the evening, they're not going to be so thirsty, and they will drink as needed. And so what the statistics we want is 80% of the fluid intake to be before 5 o'clock, and so then the other 20% in the evening. Of course, we want you to avoid juices and caffeinated drinks just altogether, but also avoid milk intake after 5 p.m., and that will also help with the nighttime wetting. So if that's not helping, and we want to add some other methods to this, there is something called the bedwetting alarm. And then also you can actually set your alarm and wake your child up. So the bedwetting alarm is quite disruptive, so be prepared for that. It is loud, and in the way it works, you have to be patient. It's going to take weeks to months as your child gets conditioned. So how does that work is you put the sensor in the bed, and when the sensor senses wetness, it's going to make noise. Initially, if your child is a deep sleeper, they're not even going to wake up. You're going to wake up, and then you'll have to go into the room and get them up, change the sheets, and have them go to the bathroom. And then for a couple of weeks, you'll probably notice that. However, they are going to get conditioned, so now they will wake up with the alarm, but they will probably wake up with the alarm and have already had an accident. But again, they'll go to the bathroom, clean up, change the sheets, and go back to bed. Eventually, a few weeks later, they're going to wake up to the alarm with just the beginning of the alarm, and hopefully by then they've only just wetted a little bit, so then they could go to the bathroom fully void, and then again do the same thing of cleaning up, changing the sheets. And then a few weeks later, hopefully they are conditioned that they're going to get up because they have the sensation to go to the bathroom. So like I said, it will take some time. If you don't want to use the bedwetting alarm because it is loud and it can interrupt the whole family, is you can set your alarm, and typically it's going to be between midnight and 2 a.m. And you'll go ahead and go get your child up to go to the bathroom. You will have to adjust that time because you're going to have to discover when they're actually having that accident, but also it might be difficult if your child is a deep sleeper to get them up. And at the end, if we think that medication needs to be used, then I do want you to talk to your pediatrician about that. Another problem that we will encounter in some of our kids is to refuse to stool in the potty. Why do we get that stool refusal? Sometimes it's because we started potty training too early, but the other reasons could be they have a fear of the toilet because, again, we either flushed it while they were sitting on the toilet or there was a splash that was created, and so now they're scared. Another is just that parent-child power struggle. Remember, you want them to go, they just don't want to go. And then the last one also is constipation. It could be current constipation, so they're afraid to go because it's going to hurt, but it could actually even be caused by just one episode in the past when it hurt, and now they're just in fear of it going to hurt every time they have a stool, so they start holding it. So what can we do when our children are having the stool refusal? One, you can still continue to ask them to go to the potty every couple of hours for the urine, but let them know that you are not going to push the stool. They need to know that you're accepting of this, because otherwise they will go hide in a corner or have accidents in their underwear without you knowing, somewhere in another room. So what you want to do is try to explain to them, hey, listen, I have this diaper or pull-up, and I will put it on you when you need to go poop. So what we will do is when they either show some signs that they have to go, like they're straining, or they actually tell you that they have to go ahead and put that pull-up on and let them go have a stool wherever they are, whether they're standing in a corner, standing in the room, you just go ahead. In a couple of weeks, when they're cooperative and they're doing this, then you can say, hey, listen, I am giving you the diaper or the pull-up still, but can we go stand in the bathroom? And give them a corner in the bathroom so that they can still stand and feel comfortable. But now we're getting them that association of stooling and going to the bathroom. And then a few weeks, if they're doing well with that, then you can say, hey, why don't we sit on the potty, but we're going to keep your pull-up or diaper on. That way we're getting them from that standing position to that sitting position, but yet they're still not having to go straight onto the potty. And then a few weeks later or a month later, if they're happy with that, then you can go ahead and see if they're willing to take their diaper or pull-up off. Remember, be patient, move on to the next step only if they are ready. Um, if there is constipation that's causing this, then we want to go ahead and correct that ASAP. If it's mild constipation, just increase the pea foods, which are pears and peaches and prunes. Also increase green leafy vegetables. Make sure they're drinking plenty of water. And then also make sure they're not drinking too much milk. And make sure we are limiting that to about 16 ounces a day. Make sure they're getting enough fiber, and you can actually even add probiotics to see if that can regulate their stooling. Again, remember, if they're constipated, they might be in fear that it hurts. So go ahead and put some Vaseline on their bottom and reassure them, hey, listen, I'm putting this cream on so that when you do have a stool, it's not going to hurt. Additionally, if they are not resistant, have them sit on the potty, and the best time to sit on the potty is about 15 to 20 minutes after a meal, because we have that gastrocolic reflex. And if we try, that is the most successful time that we will actually have a stool, so we could possibly get them onto a schedule. However, if the constipation is severe enough, they are going to go into this vicious cycle of stool withholding, and that is going to actually need intervention with stool softeners like Miralax or lactulose. So I definitely want you to talk to your pediatrician if we're in that vicious cycle. So at the end, remember, potty training, just like everything else we've talked about, requires some calmness, some consistency, but do not fear, you will be successful. So thank you for listening, and we will join you again next week on another pediatric topic.